Okay, Assalamualaikum warahmatullahi wabarakatuh to Miss Amira. Today I am Eka Ayu Lestari binti Sapwan with my partner Nur Hidayah binti Jamal will present about mental health. Okay, in this part, we will gonna share about first is introduction to mental illness, second is depression, third is anxiety, and the fourth conclusion. Okay, so we go to the introduction of mental illness. What is mental health? According to the World Health Organization (WHO), mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So next is mental illness. Mental illness, also known as mental disorder, that can affect anyone. So mental illnesses are health conditions involving changes in thinking, emotion, or behavior, which often results in difficulty to cope with life's ordinary demands and routines. So one person that could suffer from poor mental health without being diagnosed with mental illness. Okay, the next one is what the causes of mental illness. So the first one is a person that earlier adverse life experiences such as trauma or history of abuse such as child abuse and sexual assault. The second one is chronic medical illness, which is a person that experiences related to other ongoing chronic medical illness such as stroke, cancer, or diabetes. The third one is biological factors that the person having such as genes or chemical imbalance in the brain. The fourth is alcohol or drug user. The fifth is lack of social exposure or interaction that the person have feelings of loneliness or isolation. And the last one is family history of mental health problems. Okay, next is who is the most at risk. So mental illness does not discriminate. The certain types of illnesses such as depression has been found to affect one gender more. For example, women are nearly twice as likely as men to be diagnosed with depression. So in Malaysia, females are more susceptible to mental health issues compared to males, but the higher percentage of mental disorders are also found in younger adults and in adults from low-income families. So the third one is risk factor increases if you have a blood relative, such as parent or sibling with mental illness or an ongoing chronic medical condition. So some people who had traumatic life experiences were reported to be at higher risk of mental illnesses too. Okay, so next we move to depression. Depression or major depressive disorder or clinical depression causes severe symptoms that affect how you feel, think, and handle daily activities such as sleeping, eating, or working. So one must understand that depression is not something that you can get rid or snap out of it. To be diagnosed with depression, the symptoms must be present for at least 2 weeks. There is no single attributable cause linked to depression rather than there are multiple factors that combine to lead to certain mental illness. So depression, even the most severe case, can be treated. Okay, so here I have a few of common causes of depression. Depression is caused by a combination of genetic, biological, environmental, and psychological factors. So most are related to family environment, life events, divorce, death of a loved one, and retirement. So depression in youth is usually caused by issues related to self-esteem, bullying, poor academic achievement, sexual orientation, or even having been a victim of physical or sexual abuse. So for depression in older adults, that can co-occur with other serious medical illnesses such as diabetes, cancer, heart disease, and Parkinson's disease. Sometimes medication taken for these physical illnesses may cause side effects that contribute to depression. Okay, here I am going to with my last part, which is types of depression. According to the National Institute of Mental Health, people with depressive illnesses do not all experience the same symptoms. Symptoms may also vary depending on the stage of the illness. How severe they are, how frequent, and how long they last will vary depending on the individual and his or her illness. So there is three types of depression. First is persistent depressive disorder. It may called by dysthymia, which is a depressed mood that lasts for at least 2 years. A person diagnosed with persistent depressive disorder may have episodes of major depressions along with periods of less severe symptoms, but symptoms must last for 2 years to be considered persistent depressive disorder. So the second one is postpartum depression. It's more serious than the baby blues, which many women experience after giving birth. Women with postpartum depression experience full-blown major depression during pregnancy or after delivery. So the feelings of extreme sadness, anxiety, and exhaustion that accompany postpartum depression may make it difficult for these new mothers to complete daily care activities for themselves and for their babies. So the last one is psychotic depression. It can be occurs when a person has severe depression plus some form of psychosis, such as having disturbing false fixed beliefs, delusions, or hearing or seeing upsetting things that others cannot hear or seeing, or other word hallucination. The psychotic symptoms typically have a depressive theme such as delusions of guilt, poverty, or illness. So the next part will move to I will pass to Nur Hidayah binti Jamal.
Hi, Assalamualaikum to Miss Amira. My name is Nur Hidayah binti Jamal. I'm going to continue our video about mental health. So the second mental illness that we're going talking about is anxiety. An anxiety disorder is a medical condition characterized by persistent excessive worry. Occasionally, anxiety is a normal part of life, as one might feel anxious when faced with a problem at work, before taking an exam, or making an important decision. But anxiety disorders involve more than temporary worry or fear. For a person with an anxiety disorder, the anxiety does not go away and can get worse over time. There is no single attributable cause linked to anxiety. Rather, there are multiple factors that combine to lead to certain mental illness. Moving on to what causes anxiety disorders. The first one is caused by genetics. Family history plays an important role in increasing the probability that a person will develop anxiety. This means that the tendency to develop a disorder may be hereditary. The second one is caused by brain chemistry. Neurotransmitters are chemical messengers that help transfer information between neurons. Problems with neurotransmitters can affect how the brain receives the message and how it reacts, which can lead to anxiety. The last one is from environment. Traumatic and stressful events may contribute to the development of anxiety. Examples include a history of abuse, death of a loved one, divorce, changing jobs or school. So this slide we're going to talk about types of anxiety disorders. There are 6 types of anxiety, which is the first one is generalized anxiety disorders. Generalized anxiety disorder is characterized by excessive exaggerate anxiety and worry about everyday events with no obvious reasons for worry. It interferes with daily function. The second one is panic disorder. Panic disorder is about feelings of terror that attack suddenly and can occur with sweating, chest pain, irregular heartbeats, and a feeling of choking. The third type is obsessive compulsive disorder. This is about anxiety disorder with unreasonable and unwanted fears that causes repetitive behaviors and obsessive thoughts and rituals. For example, someone with an unreasonable fear of germs will obsessively wash their hands. The next type of anxiety is post-traumatic stress disorder. This means that it can be triggered by a traumatic event such as war, accidents, or natural disaster that leave people with lasting and frightening flashbacks, nightmares, and uncontrollable thought about the experience. Next one is social anxiety disorder. Overwhelming worry and self-consciousness about day-to-day social situations that can be often result in isolation and avoidance. So the last type is specific phobias. A specific phobia is an intense fear of specific project or situation, such as a snake, heights, or flying. So for this slide, we're going to talk about how to recognize someone with anxiety. Someone who is suffering from anxiety usually displays the following, which is excessive worry, sleep problems, having irrational fears, muscle tensions, reliving traumatic flashbacks, chronic indigestion, processing stage fright, becoming self-conscious, having panic attacks, and the last one is obsessive perfectionism. So, the goal of this video is to go into further detail on mental illness, particularly depression and anxiety. Determine whether or not we have the illness. If there is, try to follow techniques to maintain our minds healthy at all times, such as loving yourself, taking care of your physical health, learning how to cope with stress, or simply relaxing your mind. So we're almost done with this video, but before that, it's fine to seek some help. You can. So here are some hotlines that may offer the assistance you need. There is from Kuala Lumpur, Penang, and Malacca. Also from Lifeline Association of Malaysia and Malaysian Mental Health Association. So thank you, and that's all from us. Hope this video will give some benefits to all the viewers who are watching this video. Take care and stay safe. Assalamualaikum.